First person. Okay, so the percentage of female gastroenterologists is about 30%. And actually, it's ranked about the lowest for specialty choice among female physicians. This may be due to multiple factors, actually. Because it's actually our work is hard. It's not a very family-friendly job. And the second thing is that there are some limitations, cultural, professional, and that limits our presence in this position. First, we're going to talk about advantages, actually, before talking about our challenges and limitations. So the advantages, we all face this, that most females, or mainly 50% of female patients, they prefer to go to a female gastroenterologist because they feel less embarrassed, they feel better communication, and because female gastroenterologists, they actually show more compassion to the patients, and they are very, they take care of the details, actually. So compared to male physicians, female physicians are faced with gender-based challenges to their professional and academic success. What are these challenges? The challenges are on the professional level, the cultural level, and even on the personal level. So about the professional level, in some countries, there is a gender pay gap. Maybe in Egypt, we don't see this very much, but in some countries, and I refer to the literature and in some reports from different countries, these challenges are actually not in Africa or in Arab countries only, they are worldwide, they're everywhere. So in some countries, they have this problem, they pay females less. The second thing is that the lack of women leadership positions and support through our career transitions and advancement. The last thing is lack of mentors and sponsors. And I have been talking with my dear colleague, Dr. Shaima, about sponsoring training programs for females. We don't find this support for the training programs. Some cultural challenges also exist, like gender bias, some sexual harassment that females can face during their work. Lack of female role models, as we said, or female leaders. Not many female leaders do exist due to these challenges and these limitations, and that's why we have these difficulties. On the personal challenges, of course, are very important. And my colleague was talking about this, the work-life balance. This is very important, and almost it faces females more than males, because females, they have more responsibilities regarding family and regarding their homes more than males. Imposter syndrome, we are going to see what this means. Prove it again syndrome, lack of job satisfaction, decreasing ambition over time, and as we said, lack of comprehensive family caregiving and medical leave policies. So what is imposter syndrome? Imposter syndrome is the feeling of inadequacy despite persistent and evident success. And surprisingly enough, this actually strikes high achievers. So whenever you are achieving high, you always feel that there is not enough. Something is still missing. There is more that I can do. So you, and this feeling sometimes hinders you from your progress because it frustrates you. What about prove it again syndrome? Women feel that all the time and every time and during their work, they need to work very hard to prove themselves more and more again, every time, that they are good enough, that they are competent enough, that their success is not just for once, and it's their style. Some problems occur with, and challenges are unique to endoscopy, actually. The risk of radiation exposure for females, and especially for pregnant females, is a limitation. Work-life balance, as we said, physical strain, and I'm going to demonstrate that this is very common for female endoscopists, and they have less flexible schedule to spend more time for work and training. So this is a nice study that was, or a review article that was published by the AGA in 2020, and it was talking about the strain and injury that are related to endoscopy, and that these things are more prominent in females, that females may be associated with musculoskeletal energy, of course, due to the less physical fitness than males. So they advised for the ergonomic endoscopic environment, so that to decrease the strain. And we see this picture here on the right, the position of the monitor of the patient, the level of the bed of the patient, many things. They make us more liable to musculoskeletal injury, and this is actually a limitation as well. What about female leaders also? They face many challenges because not on the local even level, but on the international level as well. There is also another study that I found here that was published in 2018. It reviewed 81,000 subjective peer evaluations in 4,300 academic centers. They made this survey to explore the language that is used to describe men and women leaders. And also they found that women received more negative descriptions than men, according to their stereotype, because there's always being a leader, you should be more assertive and decision maker and many masculine criteria. But when you are a female with these criteria, you are being described with negative words, that you are aggressive, that you are excitable, that you are passive, or you are temperamental. So also this is something that is worldwide problem. So how to challenge our challenges? The biggest challenge is to overcome yourself or overcome your challenges. The only thing that stops you from achieving your goals and dreams are your limits. How can we do this? So this, of course, needs many things on different levels to overcome these challenges. We need on the level of the organization that we work in, and we need some solutions on the personal level of managing ourselves and managing our situation on a personal level. So we need to create work policies with a more flexible schedule for female doctors. Financial advising, of course, and mentorship is very important. We females have to empower each other and to give advice regarding our work. We need to encourage peer-to-peer support and practice this on small base group and social media network. We need to encourage young females to have open communication with their colleagues and leaders about personal career goals. We need to overcome imposter syndrome because we have to stop thinking of ourselves as imposters. We have to believe in ourselves and to develop a new response to failure and mistake making, because failure is only the opportunity to begin again more intelligently. We have to put a SMART goal which is a specific, measurable, achievable, realistic, and timely goal for our career. We need to revise ourselves. We need to revise ourselves on short-term and long-term. Short-term may be within, for example, by the end of every year. Longer-term revising may be over 5 years or 10 years. You have to revise yourselves. Where am I? Where am I standing now? And where do I want or do I need to go? I have to brand myself. If I need to have opportunities, for example, for training, opportunities for work, opportunities for a new place, a new position, I have to know how to brand myself, because if I'm not getting noticed, if people don't know me, then no chances will be available for me. But if I am known, if I am noticed, then I will get opportunities and I can prove myself. So I have to determine my unique value proposition. and find how others see me. Also, this is an important point so that I can correct myself. I have to identify my goals, identify my target audience, who are the people whom I want them to know me or to recognize me, and to recognize my priorities at this point of time. I need to pay attention to details. Update my resume is very important. Always have a resume ready at hand with updated experience, with your updated achievements. This is very important. Become a social networker and blogger. Actually, this time of our lives is very important to be on social media, and people, they just follow up. You follow other your colleagues, they follow you. What are you doing? What are your achievements? Try to get published as much as you can. Publications actually are very important nowadays for being recognized. And sometimes, you know, you need to go offline and go real. Just go to the real world and do and take your chances and opportunities. You have to tell everyone that I'm there. I am here. So I can be relevant and I can be available for opportunities. Speak at a conference if you get a chance. Don't refuse this. Ask a question at every meeting you attend. This is also a way. Network internally beyond your immediate team. Share your voice with influencers. This is very important. Sharing your opinion, sharing your experience, sharing yourself is very important to get known. If you don't define your personal brand, so others will do. Okay, so, and there's also a difference between teaching versus training. When you teach, it's like you are on one side and the others who you are teaching on another side. But training is that sharing and communicating your thoughts with others. This is like a closed circuit. It's not a one-way thing. It's going and coming. This slide is very important, and always we would like to determine where we are. These are the 4 levels of competence for any doctor. Here we start with level 1, the unconscious incompetence. When you are still at the beginning of your way, you are still incompetent and you are unconscious that you are incompetent. Then you start to be aware, so you start to have awareness. So you know that you are incompetent. So now you are conscious incompetent. With learning and change, you start to gain conscious competence. You are competent and now you know that you are starting to be competent until you are a master. When you are a master, it's a part of your personality. So you are unconsciously competent. Competence becomes part of you. It's part of your character. So then you become a master. Well, there are some global efforts for women empowerment, and this is a very nice. And also my colleague, Dr. Shaima, was with me in one very interesting event that happened in 2019 here in Cairo in a conference. Women in endoscopy. So the global organizations, they started to empower women through doing some events special for women. The American Gastroenterology Organization and the EHGC, they initiated mentor programs that connect experienced members with junior faculty or trainees. So the AGA developed annual women's leadership conference, and the Women in Endoscopy is a global organization now that supports women for the professional gastroenterology careers. And we had been in this event, and you can see me here, and Dr. Shaima also was with us during this event. And it was only, this meeting was for women from everywhere, from Africa, from Egypt, from European countries, from Arab countries. So we were all together supporting each other. Also, these are my fellow colleagues from Africa, from Sudan, from Uganda, we had been in training for doctors from different African countries, from everywhere. through the training centers of the WEO, the World Endoscopy Organization, and the World Gastroenterology, WGO, the World Gastroenterology Organization. We have the training centers in Cairo Training Center and Egypt Training Centers, and we used to meet with our colleagues from also from Africa. This is very important to have a mentor. This is very important because having a mentor guides you through the way until you yourself can become a mentor for your junior doctors. Challenge your challenges, take opportunities, even though if you feel that at the beginning, you feel sometimes you're not very comfortable, or you feel that you are not competent enough, but you don't know until you do it. So when you have a chance, take it and do it. So opportunities don't happen, we create them. And this is this is something that I'm really proud of, that this was an opportunity that I once took, and it made a big difference with me, because the WGO, the World Gastroenterology Organization, they have different committees. So they have trained the trainers committee, and once they announced that they are having training courses, I applied for one in 2019. And this was in Romania, and I got accepted, and I went there. So when you take an opportunity, when you have an opportunity and you take it, try to get recognized, as I said. So getting recognized, then proving yourself can lead to you to success. So, and then I was nominated as a member for the WGO Train the Trainers Committee. So the take-home messages that I want to eliminate here is: listen to inputs and criticism. Leadership is not about title, it's the ability to influence and inspire those around you. Paradigm shift is required for women to benefit from opportunities, skill building, sponsorship, and support in pursuing leadership strategies. Be open to change. This is very important. Challenge your challenges. Stepping out of your comfort zone is very important, because if you stay in your comfort zone, you will not progress. Go to new areas, new places. On the opposite side of fear is growth. Have a mentor. Having a mentor to being a mentor. This is our journey to success and journey to life. Show yourself, show that you are there. Thank you.